a couple of things to start with. Any of you have teenage children or grandchildren?
Yes.
So the Council of Premiers says as we get older, our population ages, we should pay more attention to dementia. Well, duh. Number two, John Flood, thanks a lot. Now my staff has something else to shut me up. No Tim, no Tim. Actually, they usually just don't give me a microphone, that's all. I was asked to speak in this panel, and participate in this panel. Actually, by the way, thank you very much for that. I appreciate always the chance to speak to people about anything to do with dementia, but specifically today about my role, or the Provincial Geriatrician Program's role in after the diagnosis, post-diagnosis. Most of the time, not all the time, but most of the time in Prince Edward Island, it's the geriatrician program that is heavily involved in making the diagnosis. Our neurologists also do, and some of our psychiatrists also do as well. And you know, there's a lot of very good family physicians out there who also are very comfortable making the diagnosis of dementia. So as part of the geriatrician program, I don't have the exclusive role in making the diagnosis, but we do a fair bit of it. So what about after the diagnosis? So I was thinking about that. Generally, I find I'm involved in about 3 distinct areas. One is someone who's well and forgetful and concerned, and they've heard about it. It's on TV, they've read about it, they have a loved one who's gone through it, they know someone, and they say, you know, doctor, I can't remember a thing, and I certainly don't remember like I used to. And so there's this diagnosis of just mild memory troubles. There's a diagnosis of something called mild cognitive impairment. There are people who have other illnesses that present with memory problems, such as depression, certain medication side effects. There are lots of other things that can cause memory symptoms. And so I tend to be involved in that regard. I tend to be involved after the diagnosis of dementia when the diagnosis is made early. Tend to be involved later on when the cognitive symptoms are less important and some of the behavioral symptoms start to become more important, and I get asked to see people related to that. Mention that a little bit more in a bit. The other area I tend to see or get asked to be involved in has to do with competency and who makes the decisions now. And you know, we were reminded many times in the past that it is not a doctor who says you're not competent, it is a judge who says you're not competent. But the judges usually listen to what we tell them. And so often as the dementia progresses, sometimes because there are conflicts within families, or sometimes just because of things that are expedient and need to happen, we're asked to be involved with that kind of an assessment. So the diagnosis was made, the lives have been lived, and things changed, because the unfortunate thing with this illness is, as you've heard many times this morning, is it progresses. It doesn't stay the same. It always gets worse. It doesn't get better. And at least in this day and age, where we are right now, we're still at a stage where we can't fix it. I was incredibly thrilled by Dr. Darvish. By the way, he is the smartest man I know. I had the distinct pleasure and privilege of actually doing quite a bit of my training with Dr. Darvish. So, you know, anytime you get a chance to hear him, make sure you take that chance, because he just knows. And I mean, he doesn't just know one thing. He knows all kinds of various things. So, you know, so if we can diagnose this illness before clinical symptoms happen, that would be a major, major coup d'etat. Because unfortunately, as we are right now, this is a clinical diagnosis, which means we've already lost a lot of brain function before the functional symptoms that allow us to diagnose it show up. And there's a lot of research ongoing about how do we diagnose it before there's clinical symptoms, and along with that, is there something we can use to treat it that would stop it in its tracks so that maybe you never get the clinical disease. That would be wonderful. We're not there yet, and that's the unfortunate thing. We do have, actually right here in Charlottetown, research ongoing looking at those kind of things. How do we treat this illness? How do we stop this illness? How do we stop whatever processes are ongoing so that we preserve function, we preserve cognition, we preserve behavioral. So from my standpoint, this can be a very frustrating illness because sometimes you'll try something, I find myself increasingly being presented with people who are at later stages of dementia where the big issue is the behavioral symptoms. And unfortunately, our track record in significantly helping that is not great. Although sometimes we do have successes, and sometimes we can find a medicine for a specific person that works really well for a while. But as I'm sure you all know, we're fraught with failure in our medicines. Sometimes things seem to work okay, but the side effects are intolerable. Sometimes things seem to work for a while, but then they don't last as the illness progresses. We are unfortunately presented very often with people who get very agitated, or people who don't recognize family, or people whose language abilities are lost. And how do you reason with someone using language if they don't understand language well? I was told yesterday by one of the hospitalist physicians. She looked at me and said, "Oh, Tim, you're such an optimist." And I am an optimist. And that's why I continue to say, okay, well, we've tried that medicine, that didn't work. Or it only worked for a while, or there were side effects. Let's go to the next one. Well, that one didn't work. Well, let's go to the next one. We have a list of medicines that may or may not work. And we try to pick the one that has the greatest likelihood of working first. But you know, what worked for Fred might not work for Joe. And unfortunately, we don't know that ahead of time. And so this is after the diagnosis, my involvement tends to be one of very much trial and error. I really like it when we're successful. It feels really good. It's very frustrating, and it's heartbreaking when you're not successful, because some of the symptoms, the people that have the illness are suffering. You know, there was a fellow I saw recently who he had this idea that his children were missing. His children are older than me, but where he was in time was when his children were small and they were missing. Can you imagine the grief of that? And even though it wasn't real, the grief is real. The feelings are real. And these are some of the challenges we're faced with. And so when I hear, you know, can we diagnose this before there are symptoms? Are there companies that are working on drugs that are going to stop this thing in its tracks? That's encouraging. That's the hope for tomorrow that we talked about last year or the year before.
This year I've been doing
yeah. So the thing is where do I get involved after the diagnosis? Mostly behavioral symptoms, mostly trying to adjust medications, mostly trying to take away things that are causing side effects and some symptoms, trying to pick the right medication. And any of you with whom I've been involved, and I have a lot of faces here that I recognize, some who I can even put names to, although that's the minority of them, who you know. It's sometimes we have some successes and sometimes we don't. But we keep trying and we keep moving and we keep going. You know, I have, my parents are 78 and 73 and have not yet developed dementia. And like all the rest of you, I hope they never do. So sometimes I'm presented with questions of, well, what do I do with this? And I just have to be honest and say, I don't know. But I know who does possibly have some answers for you. And we talk about the Alzheimer Society, because the Alzheimer Society uses people who have been through this and who have dealt with this and who have found this seemed to help me and that seemed to help me, but this really didn't. And when Dr. Stultz said, try this, not a chance, right? So, you know, they can be of great help, and so we certainly do tell people, you know, the Alzheimer Society is somebody you need to talk to, because they have answers to things that I don't. So that's probably the majority of things. So anyway, I think that's all I need to say.